Okay, we're starting doing composite filling here on tooth number 20, and we're starting to check the patient to see what's going on in his arch. So let me have the basics. Yeah, let's just put these. And now give it to me. Here we go. So we have the Explorer and the mirror. We're not turning on the light so that you guys can see better. And I'm just checking here. Okay, let's go ahead and start numbing him. So give me the topical anesthetic. Okay. And that's the topical. So we'll put it here. And then you can give me the local anesthetic with a syringe.
Sorry, guys.
Yes, so hold it a little bit more from the top, and then you'll hand it to me like that. Whoop.
Sorry.
Let me give you that first. And then, there we go. You can take that off, right? But we're just here to protect ourselves. We're not going to do it. Okay. So hold your air water syringe and the saliva ejector so that you can rinse the patient mouth afterwards. Okay. That's good. So we rinse the patient mouth because they taste a bad taste when they do the topical anesthesia. Okay. So now usually it will take some time for the anesthetic to work, and meanwhile you can do the shade guide checking. So you can ask your patient and see what will match their teeth color, right? And you can take maybe one of these out, and then you try to match it, and then maybe or two, and see which one he prefers. Usually it's more for anterior teeth than posterior teeth, but let's say we got some, let's say, I don't know, B2A2. So we try, what the assistant should do is to check the same shade guide, to take the same shade guide with the composite that we have. Anyway, so that's what we do. Here we go. And now I am back, and let's go ahead and check if the patient is numb. So I'll just check just to make sure the numbness worked. I'll go around just a little bit the gums and see on the tooth also. Do you feel this? Do you feel that? No. He's good, so he's numb. And we're going to go ahead and start drilling. Okay? So I'm going to put the burr in. This is a high speed. And I have my burrs here. The assistant, Joanna, is going to take the air water syringe and the HVE, the high volume evacuator, and then will be helping me out. So let's turn this off for a second. I'm going to turn off the vacuum. So we're going to put this in here, right? So the tip of the HVE is towards the teeth. Hopefully you can see that, right, like there. And then the air water syringe will be ready to rinse whenever I stop throwing. So go ahead, hold this up. And again, we're not turning on the light so you guys can see. I'm going to hold my mirror here just to reflect the tongue. And then we're going to go ahead and start drilling. Let's turn it on. All the way. Dry. Put that water a little bit. So what we do, we rinse with air and water. We rinse with air and water, and then we dry with only air. And sometimes you can also dry the mirror for the dentist with your air. Okay. Now let's keep drilling. brush. Okay, what we can do now, I'll check with my spoon excavator so I can take out any soft dentin or any other debris that are close to the pulp. And so hold a 2x2 in your hand. You can put that aside a little bit. The tooth is coming out, but and you just wipe it off. So I'll clean it up and you wipe it off. Okay? It looks good. Now we usually just kind of rinse it a little bit. And now I'm just going to put this here on my side. Now let's get ready to isolate because we're going to do the ABC of the composite, which is acid etch, bonding, and then composite, right? So we're going to isolate. So Joanna got me, what do you call this? Con roll, right? So hold it from the top. Boop.
Forget that.
Lost. Okay, and then you're going to give it to me in my hand. Hold the other one in your hand. I'm going to take it and then put it here. Get the etch. Hold it. Hold it like that. Take my instrument. Exactly. Okay, can we get one more of these guys? Well, I have one here. Okay. So why we put etch? Because we want to. Right? It opens up the dentinal tubules. How long we put it? We put it for 30 seconds, and we do not cure it, right? And then we would rinse. Oh, and the tooth would look frosty afterwards. If it's not, then we have to rinse it again. Let's get the HVE. We can put this down. Yeah, we can just put that down. There we go. Okay, so we're going to rinse with the when we rinse the edge. You want to get closer to the tooth itself, the one tooth that we're working on. Okay, and that's when we're going to rinse. So go ahead, hold that in there, and turn it on. And you can see. Now we're just going to rinse. Okay, that's good. So technically we want to rinse for another 30 seconds or more. And now we're going to change the con roll. So hold the con rolls in your hand. Down here. And we're going to get ready for bonding. Okay. I'm just going to remove his cheek a little bit out of the way so we can see. Okay, so let's go ahead, get the bonding ready. So we have the micro brush, and then we're going to dip it in the mixing well. I'm going to give it to me and hold the mixing well here. So we'll apply bond, and then we're going to cure bond for 20 seconds. Okay, always cover the mixing well. I'm just going to air dry bond, and then you want to have your hand on the other side so you're protecting whoever is on the other side, and then make sure that you're on the tooth. Look and make sure that there. You don't want to touch the tooth itself. You can always rotate this tip and rotate this so you can work on the actual one. You don't want to touch it, but you want to be really close to it. We're doing 20. Yay. Okay. Now we're ready to go ahead and do the composite. So usually I put my hand like that for a composite gun. We have different composites. This is a flowable composite. I can ask you for a flowable, and I can ask you just for the packable, and you'll put it in my hand like that. Yes. Take the tip off. Yes, and now we can work. Get the composite instrument ready. Here you go. Composite instrument. Get a 2x2 in your hand. So just wipe the instrument. Here we go. They might use all kind of different composite instruments, so they come in different shapes. Okay, we're going to layer it, so we're going to cure one layer at a time. Okay, go ahead and cure. This time we're curing for 40 seconds. So you cure it for 20 and then you cure it again. Okay, now let's get more composite. Yes, composite instrument. Composite instrument. You take this with this hand. Hold it. Yeah. There we go. 2x2 in your hand. Go. Just trying to return, get the shape of the tooth to the normal shape. Okay, let's go ahead and cure. Another 40. Uh, 40, right? We did twice. We'll cut it in the production. Right. So after that, if we're done with this, we'll remove the con rolls, and then we're going to try the bite, the articulating paper. So removing these con rolls. Just cover this. Then we're going to try the articulating paper. So we're using it this way. Say a little bit of the articulating paper is free, and that's the side of it, and then we're just going to push the cheek with it out, and then we're going to ask the patient to bite, 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 tap, 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 side to side, and this would register the colors on the teeth that you might not see here, but so anyway, it will register the teeth, the colors on the teeth, and we'll see if there's a high point on the teeth that we worked on, so we can reduce that and get the patient a correct bite. If not, we just need to wipe these colors out of the patient's teeth, and we're done.